All right, here we go. Hello, everyone, and thank you for attending this webinar on how to respond to a records request. Just a quick disclaimer before we get going. The information being provided is for educational purposes. It's not intended to substitute your clinical decision making or billing protocols. It's not intended to be legal advice. Every attempt has been made to make certain that the information is 100% accurate. However, it's not guaranteed. And we have a lot of people listening to this webinar today. Some of you are past attendees of our webinars and seminars, and some of you are members of Target Coding, but some of you are brand new to my company. So let me tell you a little bit about myself. My name is Dr. Marty Kotler. I am the president of Target Coding. I am a chiropractor. I practiced for 16 years prior to starting my company, Target Coding. I'm also a certified professional compliance officer and certified billing and coding specialist. That's what all those letters are after my name. And my area of expertise is in compliance as it relates to billing and coding and documentation, risk management, cash practice compliance, record keeping, Medicare, and HIPAA. And I'm kind of unique. I'll tell you why. Most doctors are not certified coders. Most certified coders are not doctors. So you'll see how I combine both specialties to help you improve productivity, maximize reimbursement, prevent problems, prevent audits, reduce administrative burden. Want to show you how to get paid for everything you do. Target Coding has been helping thousands of doctors and their staff members for over 18 years with our products and services. Now, those of you that are members of Target Coding, you will get a certificate of attendance for attending today's webinar. Put that certificate of attendance in your billing and coding policy manual, and you could use that as proof just in case you get audited or you get the coding police knocking on your door. You could prove that you take billing and coding seriously and you care about preventing fraud and abuse. Members, you could also get the playback recording of this webinar if you would like to listen to it again or share it with a staff member. You can get all the PowerPoint slides that I'm showing. Just log into your account and you'll be able to retrieve that. Okay, ready to have some fun? I don't know if this is fun. This is talking about a records request, a possible audit. I don't think it's fun, but I'll try and make it educational and interesting. So here's my first question. Have you ever received a letter from an insurance company requesting patient records? Hopefully you've never had that happen, but some of you have. So what do you do? Well, to begin with, take a look at the letter. Look at the names of the patients that are in the letter that you received from the insurance company. Do these names look familiar? Are these your patients? Probably yes. Now, I have seen some providers get correspondence from insurance companies that were not intended for them to receive. There were names of patients that were not from the practice. So check the names, pull the patient charts, and start to review the records. Check the dates of service. If you're going to submit the records, submit the records for the dates of service that you submitted to the insurance company. You may have seen this patient for wellness and maintenance care and had the patient pay cash. You don't typically have to provide those records, only the ones that they request. Check for medical necessity. So after you review the records, do the dates of service coincide with the date of service that the carrier is requesting? Let's assume the answer is yes. Now, before we move on, I'm going to be focusing on a request of records from an insurance company. Now, um, you may get a request for records from a malpractice case, a malpractice carrier. It's a different approach. A patient may have filed a complaint with the state board, and now the state board wants to see your records. Different approach than getting a letter from an insurance company. Or sometimes the patient just wants a copy of their records. Patient may be moving out of state and is requesting a copy of their records. So there's different reasons for giving patients um, giving up your notes to patients or insurance companies or malpractice situations or state board situations. Now, if a patient is requesting a copy of their records, make sure they sign that authorization to release information HIPAA form. And please do never alter your records. Once they've been entered into the chart, into your system, whether you are using a software program or paper forms, never alter the records. Sometimes you have to make an addendum. That's okay. You just have to date it the day you do it, which may be months, maybe even years after the date of service was provided. Typically, in the request for records from an insurance company, they tell you when they want the records. There's probably what I call a deadline. So after your initial chart review, ask yourself, will you be able to gather all the requested information by the deadline? You might not be able to. Typically, the request for patient charts need to be submitted within 30 days of the date on the letter you received. So this may not be reasonable. You might not have enough time to pull the charts. Maybe you're about to go on vacation for 3 weeks. Maybe your staff that's in charge of helping you with this is not going to be in for a while. There could be many reasons why you might not be able to gather the records in time. If you can't, call the carrier. You're not admitting guilt. It's okay to call the carrier and request an additional 30 days to submit the information. 99.9% of the time, they will allow you an extension. Just don't ignore the letter. Don't ignore the request for records. Let them know that you're making good faith attempts to abide by their request. A little bit about risk adjustment audits. You may be getting letters in the mail or a fax from a Medicare Advantage plan that you work with. Recently, WellCare has been sending letters to many doctors requesting records. These are Medicare Advantage plans requesting records. This is not a standard post payment audit. This is considered a risk adjustment audit. It's not a post payment audit. If you send in your records, don't get concerned about them asking for money back. A standard post payment audit is totally different. You may have to give the money back. But a risk adjustment audit, they're looking for the diagnosis codes that you build. And this is interesting with Medicare Advantage plans. If there are more patients in this Medicare Advantage plan that are healthier than others, then they have to transfer funds to plans with more complex health conditions. If a Medicare Advantage plan has a lot of unhealthy members, they get more money from the federal government. And there have been many situations where Medicare Advantage plans were fined and penalized and had to pay back the government millions of dollars. Now, if you're not sure if it's a risk adjustment audit, send me the letter. I'm happy to take a look at it. It probably will say somewhere in the beginning of the letter that it's a risk adjustment audit and it's not a post payment audit. Many doctors that are getting these letters start to panic and they think they're going to have to give money back. They're not sure why they're even getting it. I will help you figure it out. Now, should you contact the investigator, the auditor that sent you the letter asking for the records? If I don't think there's any downside to speaking to this person. You may have the opportunity to speak to the lead investigator. Just don't provide any information to the investigator that could work against you. Some of the doctors say, well, Why was I chosen? Why me? What did I do? Now, if you send me your notes to review, there may be something there's a common denominator. You've seen that occur where that's what's causing the red flag. Something like every patient on the third visit is getting a TENS unit. Every patient is getting the same diagnosis codes and procedures. Even after 50 visits, the patient is still getting 4 units of massage. There are certain common denominators that can trigger a red flag. The use of the 5-9 modifier, there's many things that can do this. So you may be wondering, why did I get a letter? Why do I have to send in the records? So now you may speak to an attorney. Some attorneys may not recommend you speak to the investigator at all. I don't see anything wrong with speaking to the investigator. Ask the investigator, why were you chosen for this chart review? They may or may not tell you. Just don't volunteer any information that could link you to any wrongdoing. Now, some chiropractors, they'll obtain the services of an attorney as soon as they receive any type of request from an insurance company. I don't see any downside to doing that. There's nothing wrong with speaking to an attorney about your situation. The attorney is not going to contact the insurance company. Some doctors think, well, if I get an attorney, isn't that admitting that I did something wrong? You're just speaking to the attorney. The attorney will be working for you. The attorney doesn't have to contact the insurance company. Now, there's a certain threshold. My threshold for getting an attorney is usually about $20,000. $20,000 or less, usually I can negotiate on behalf of the client, or I can give the information to the doctor to try and negotiate it on their own. Over $20,000, I typically recommend getting an attorney involved. But that doesn't mean the attorney is going to be contacting the insurance company. Now, there are times where the notes just don't give a proper breadcrumb trail. If you've been to my seminars and webinars in the past, you know how I always talk about the importance of creating a breadcrumb trail. The breadcrumb trail, you know when it starts? It starts with the patient's forms. What did they write on the form when they first came in, where it says chief complaint, reason for the visit? If they put neck pain and you're billing for low back pain, the breadcrumb trail is not going to fit properly. So make sure you're creating that breadcrumb trail. It starts with the patient forms. Next breadcrumb is the patient's history. What did the patient say to you? What's going on with them? Then it's your examination, diagnosis. Does the diagnosis match the CPT codes? That's the next part. The CPT codes that you're billing. You see, your CPT codes are what you're doing, your diagnosis codes are why you're doing what you're doing, and they should match. So if your notes are following a good breadcrumb trail, then feel free to just send in the notes. Sometimes they just don't follow a nice course. So that's when a treatment summary makes sense. I typically recommend providing a treatment summary for every patient. A summary of the care you provided helps the carrier understand your clinical approach. However, they're not required. If you think your SOAP notes and treatment plans are sufficient, it's not necessary to create a treatment plan. They could be time consuming. Many insurance companies, they post their position statements on chiropractic, their medical necessity policies on chiropractic. And this is where some doctors make a mistake. Worked with probably over 100 doctors that have been audited over the past 18 years. And many times I'll ask the doctor, have you ever read the insurance company's policy on chiropractic prior to getting this request for records? 80% of the time, the doctor says, I didn't even know it existed. So take a look at these position statements. Here's a sample one from Aetna. Aetna has a policy on chiropractic. It says Aetna considers chiropractic services medically necessary when all the following criteria are met. And that's what hopefully, you're following the criteria that they outline in their policies. Make sure you learn as much as possible about evaluation and management coding, patient goal setting. Just remember to stay calm. Just because you received a records request doesn't mean you did anything wrong. Many times, the insurance companies will want money back because they don't think your notes proved medical necessity. What is medical necessity? Patients don't typically know what medical necessity is. Sometimes doctors don't know what medical necessity is. Do your staff members know what medical necessity is? Well, it depends who you ask. If you ask Aetna, they'll give you their policy on it. So I'm going to give you my opinion based on reading numerous insurance company policies, including Medicare, on what is considered medical necessity. Now, if you think about it, medical necessity equals insurance payable. 90% of the patients that walk through your door have insurance. And that insurance, because of the Affordable Care Act, has a chiropractic benefit. So 9 out of every 10 patients that walk through your door have insurance and includes a chiropractic benefit. So they may think everything you do is covered. They might not realize that wellness care is not covered. They might not know that laser or decompression or shockwave is not covered. And sometimes it's a surprise to them. So communication is very important. Now, as far as I mentioned, Medicare, Medicare considers active treatment medically necessary. That's why you have to use the AT modifier on the spinal manipulation codes in order to get paid. So, a simple definition of what medical necessity is: the patient has pain, restricted motion, not only pain, just the mere presence of pain does not equal medical necessity. Pain, restricted motion, decreased ability to do activities of daily living. That's typically covered by insurance. Now, that typically doesn't last 80 visits. Depends on the diagnosis. It depends on any exacerbations that are occurring. So, what is maintenance care? Well, it depends who you ask. If you ask CMS, the definition of medical necessity is it's a service or treatment that's required to identify an illness or injury that's consistent with the patient's symptoms or diagnosis, appropriate under the standards of care, not solely for the convenience of the patient or the doctor. It's the most appropriate service which can be safely provided and accomplishes the desired end result in the most economical manner. What about Medicare? Medicare Part B. According to Medicare Part B, maintenance is not a covered service. They don't consider it medically necessary. Therefore, it's not payable. But the definition of it is interesting. It says maintenance therapy includes services that seek to prevent disease, promote health, and prolong and enhance the quality of life or maintain or prevent deterioration of a chronic condition. You read that, you would think that's a really good thing. Medicare should cover that. Every insurance company should cover that. Well, there are some insurance companies that are starting to cover maintenance care. I've seen it. Some Medicare Advantage plans are covering wellness care, supportive care, and maintenance care. Now, as a reminder, once those Medicare Part B patients, I'm talking about the patients that come in with the red, white, and blue card, Medicare Part B, once they get to maintenance or wellness and they check yes, that they want you to bill Medicare on the ABN form, which becomes required at this point, do not use S8990. Are you familiar with that HCPCS code? HCPCS codes are codes that begin with a letter followed by four numbers. S8990 is manipulative therapy performed for maintenance rather than restoration. Do not use that for your Medicare Part B patients. All others, you probably could use it. Now, just because there's a code for it doesn't mean it will get paid. Now, in my opinion, there are three phases of compliant documentation. Phase one is the treatment plan. Phase two are your SOAP notes. Phase three is the reevaluation. Your treatment plan is the foundation of care. That's why I have a house in the bottom right corner. That foundation of that house, look at that house, it's crumbling. It doesn't have a good foundation. If you don't have a good treatment plan, your notes, which are typically built upon your treatment plan, will crumble. They won't make sense. So your treatment plan should consist of six things: history, exam, diagnosis, goals, services rendered, and the schedule of care. Now, a treatment plan is not the same as a treatment summary. And a treatment plan doesn't have to be created after the first visit. Many of you will do a history and exam on day one, and then maybe on day two or day three, you give the patient the diagnosis. You're going to tell them how much you're going to be able to help the patient, how much it's going to cost. So that might take two or three visits. That's okay. And then your soap notes are going to follow what your impression is in your treatment plan. It's just going to go by what you outlined in the treatment plan. And then your reevaluation, phase three, that's your opportunity to remeasure and update your CPT codes, update your diagnosis codes and care plan. At the first reevaluation, most patients need to get their diagnosis codes updated and CPT codes updated. Why am I saying that? Because chiropractic works very well. You know that. Most patients get better after 6 to 12 visits. I'm not saying they're done, they're complete, and they're ready to get discharged to maintenance care, but most patients get better pretty quickly under chiropractic care. That's one of the beautiful things about what we do. So if Mrs. Smith comes in with low back pain and sciatica on the first visit, and on the 12th visit, she says, I don't have pain down my leg anymore. So that's your opportunity to do a reevaluation, update the diagnosis code, get rid of sciatica, update your CPT codes, and update your schedule of care. Now, some doctors like to put in the phase of care in the notes. I don't think it's necessary. However, let's go over it. I see this in many offices' software programs. The patient is in the acute phase of care, subacute, therapeutic, corrective, relief, initial intensive, active, or wellness, maintenance, routine, rehabilitative. So many different phases of care. Now, the phases of care in the blue box are typically covered by insurance, whether it's a cash patient or not. It's typically covered by insurance because that type of care is considered medically necessary. In the green box, that's typically not covered by insurance. So the patient should be paying cash. So, with all these different phases of care, in my opinion, there's only two phases: active therapeutic care and wellness maintenance care. Active therapeutic care, restricted motion, inability to perform normal activities of daily living, muscle spasms, sprain, strain, decreased functional performance. So, this is covered by insurance. Now, again, back to cash patients. A cash patient can come in, pay you cash, they're not going to use their insurance, but they have restricted motion and ability to perform their activities of daily living. So this is active therapeutic care. Some offices will confuse, well, the patient is paying cash, so that's wellness care. No, it doesn't automatically mean wellness care. Now, wellness and maintenance, in my opinion, is not the same. Wellness care means the patient is coming in, doesn't really have any pain, has normal range of motion. They're coming in to prevent problems. They're running, they're exercising, they could do all their normal activities of daily living, but they're coming in because they want to prevent problems from coming back. That's wellness care. Maintenance care is a patient that comes in, let's say their pain scale is a 5. 12 visits later, they're still a 5. No matter what they do at home, no matter what you're doing, they've reached maximum therapeutic benefit. They've plateaued. That's considered maintenance care. Well, that's not covered by insurance. Most insurance plans do not cover that. Some offices that are involved with post-payment audits, they get caught in the middle. The notes look like it's maintenance wellness care, but they billed it as though it's active therapeutic care and got paid, and now the insurance company wants money back. So if you get a letter from an insurance company and they want money back, this is the time to negotiate. You'll need to put together a response letter. If you're not familiar with the response letter, contact us. I've helped negotiate many doctors, very good at it. It's one of my areas of expertise is helping negotiate and put together a letter letting the insurance company know that your intent is to provide optimal care tailored to each specific patient's needs. You have a zero tolerance for inappropriate billing and coding and documentation. And sometimes you may need to admit that your record keeping skills need improvement. And you're going to let them know that you've already made changes. That's important. If you get a request for notes and you look at your notes and they're not good, and now you're negotiating and it takes another couple of months, but you haven't made any changes, that doesn't look good. It doesn't show that you're making good faith efforts to make a change. Start making changes right away. If you're not sure what changes to make, contact us. We could let you know exactly what to do. One of the things you should do is put together a billing and coding compliance manual. If you tell that to an insurance company that you've put together immediately after getting, assuming you don't have a billing and coding compliance manual, as soon as you get that letter from an insurance company requesting notes and you put together a billing and coding policy and procedure manual and you let them know that you've done that, it makes you look like a good guy. It makes you look like you're making good faith attempts to do the right thing. And they'll be lenient most of the time. So if you need help with this type of situation, we could work with you on an hourly basis. We put together billing and coding policies and procedure manuals all the time. They're customized for your practice. It helps your staff get structured. Doctors, staff members want structure, they want organization. That's what this does. It also prevents whistleblower action. So let us know if you're interested in getting a billing and coding policy and procedure manual. You know what it'll do? It'll help you SWAN. You ever hear that acronym, SWAN? That means sleep well at night. Prevention is the key. 80% of the doctors that send us their notes and I do chart reviews on are doing it to prevent problems. 20% are in a crisis. They're being asked back for money from an insurance company, or they're in a prepayment audit, or it's a malpractice case, a state board complaint. Don't wait for that to happen. Don't wait for the oil light to flash on your dashboard. Target coding can help you reduce audits. About 30% of the offices we work with are cash practices. So even cash practices could have problems with notes. We could help identify compliance gaps, help you prepare for insurance audits. Compliance isn't an expense, it's an investment in your practice. You don't want to leave money on the table. The opposite could occur. You're providing services and you didn't even know you can get paid for it. You deserve to get paid for every minute you're with the patient. That's how we look at these situations. I mentioned Medicare a few times. That's one of our areas of expertise. We are 10th degree black belts in Medicare billing, coding, documentation, ABN forms. We even do credentialing for Medicare. Many of the doctors say something like this. Well, I'm a PI practice and Medicare. I'm a cash practice and Medicare. 99% of the doctors we work with accept Medicare patients. And that's a good thing. Why have so many chiropractors chosen to work with us? Because we'll help you get paid faster, get paid correctly, reduce denials, improve documentation, we'll help you stay compliant, and we want to protect your practice. We want to be your partner. We provide the tools, resources, strategies to help you optimize reimbursement. How do we do that? We do that many ways. We do that with our webinars and seminars and on demand list of libraries. If you go to our website, you'll see the on-demand page. Many of them are approved for CEUs. We have a 6-hour webinar marathon coming up on September 17th and November 14th. We do these every 2 months. These are approved for CEUs in over 30 states. We offer memberships. Many of you listening to this are members, so thank you for being a member. Level 1 membership is only $99 a month, pay as you go. Attendance to webinars, CA boot camps, unlimited question and answer support. You get videos and newsletters. Our CA boot camps include these 6 one-hour courses. I mentioned our billing and coding policy manual. Forms. I mentioned the breadcrumb trail. It all starts with forms. Would you like us to review your forms? Your patient intake forms, assignment of benefit forms, consent to treat forms, consent to treat minor, HIPAA forms. There's a lot of forms. Send us your forms. We charge $3.95. We'll do a complete forms scrubbing. If you don't have a good form and we have one that would replace yours, we'll give it to you. We also review notes on a regular basis. We charge $4.95 for that. I mentioned we do credentialing for Medicare. You need a PTAN number? We can help you. You're really busy. You're bringing on an associate chiropractor? Congratulations. That's fantastic news. Well, you need to get the associate chiropractor's benefits, Medicare benefits, reassigned to your practice. We help you fill out the forms. We do it with you online. You may have had a staff member that went into the PICOS website and that's the contact person and that staff member is not with you anymore. That can cause nightmares. Let us help you. We also do HIPAA policy manuals. Our HIPAA policy manual includes the billing and coding manual. You get 2 for the price of 1. We have tons of forms, logs, templates. We do credentialing. I wrote a book on the best codes to improve reimbursement. It should be part of every chiropractic library. 3 sections. Section 1 gives you a list of diagnosis codes that are considered long-term treatment diagnosis codes like sciatica and herniated discs. You get these on cheat sheets that are emailed to you. At a quick glance, you could see which codes pay for the most visits, which codes pay for the least amount of visits. You get PI cheat sheets, Medicare cheat sheets, best cheat sheets in the industry. Section 2 shows you how to pair your codes. I mentioned this earlier. Your CPT codes are what you're doing. Your diagnosis codes are why you're doing what you're doing, and they should pair. Helps prevent denials. So we have a whole section on this in the book, and it's broken down by anatomic site. Section 3, I put on my clinical hat. I give you 25 of the most common chiropractic diagnosis codes and a little checklist. What are the subjective findings, orthopedic findings, neurological findings, chiropractic findings? Back to the breadcrumb trail. You also get this cheat sheet, this spreadsheet actually, on the excludes 1 edits. There are certain diagnosis codes, if billed on the same claim, could get a denial and you're not even sure why. This book will alleviate that. For example, you shouldn't submit low back pain with strained low back muscles on the same claim. Don't submit low back pain and low back pain with sciatica on the same claim. Don't submit lumbar herniated disc and lumbar radiculopathy on the same claim. That's all part of the book. We have a lot of testimonials. Of course, we have options to fit every practice. One of the things you should do is to follow us on Facebook, Instagram, LinkedIn, YouTube. I just uploaded a video on YouTube. Go to YouTube in the search engine or search area, put in target coding. You'll see my channel. You'll see all my free videos. Now, here's my general contact information. Email info@targetcoding.com, website targetcoding.com, telephone number 1-800-270-7044. If you have to fax us something, we have a HIPAA secure fax number, 844-831-2347. If you'd like to set up a free consultation about today's topic or any topic regarding chiropractic, billing, coding, documentation, Medicare, HIPAA, scan that QR code in the bottom right corner. If you have questions, email them to info@targetcoding.com. If you don't want to scan the QR code, you could give us a call to set up a free consult or send us an email. I'm happy to discuss your practice, see if we could help. All right, we are done. I want to again thank you for attending. I hope you learned a lot. Take care, everyone. Bye bye.